Welcome back to the Move to Spain podcast. And today we have Areti with all things health insurance. How are you?
I'm good, John. How are you?
I'm fine. I'm fine. Again, this is a new thing. We've got the video now so you can see us. People on the podcast makes no difference. But if you go on their YouTube channel, Move to Spain Facebook group, you'll be able to see us. Now, it's not a necessity to have a lawyer when you move to Spain, but for the vast majority of people, they're going to need health insurance, aren't they?
They are, unfortunately or fortunately for us.
Yeah, so unfortunately, well, fortunately for Ariete, but for the good of the audience, we have to talk about
Yeah.
health insurance and health in general in Spain. But what was interesting was before I spoke to you, I was looking up some figures, and you get people that live in different countries, and they think, oh, what's it like in Spain? You know, is it the doctors coming on a donkey with a rusty knife? I mean, that's absolute. I couldn't think of a more modern example. But when I looked, and I'm reading viewers, I haven't remembered this, but Spain is 83 years compared to 81 in the UK, and surprisingly, you ready, Americans, 77 years. So
That's
we're living a
crazy.
long time here, aren't we?
We are, especially in the Canary Islands. I think the average age for death. Do
Well, death comes to us all.
you want to cut that out?
The average age for death. There you go, people.
I'm
We haven't
so
rehearsed this. For podcast listeners, Ariete is now at the side of the
sorry.
normal service will be resumed soon.
I'm so
Watch
sorry,
the
John.
video, it's quite funny. Anyway, so
For Christ's sakes, I'm so sorry. What was,
we have
what
to
was
keep this in. It's absolutely brilliant. So anyway, people in Spain statistically
it?
the United Kingdom and the United States when Ariete is
Yes,
laughing.
yes. But in Canary Islands, it is a fact that people live longer.
There you go. Live longer. Yeah, health
Yeah,
insurance can be health insurance can be fun, everyone.
yeah. Okay. What a surprise!
It's having a great time, and I just had water with my lunch.
If you're looking at the newspaper or the every so often when the news comes up about an important person of the island passing away, or someone that was well known and very loved by the native people who are from here, they always say that they're always passed away after the age of 100.
Wow.
Yes, I'm telling you, it's a fact. You can look at all the is it obituaries
Yeah,
in the
obituary.
Canary
Yeah,
Islands.
yeah.
It's weird if you see someone under the age of 90.
Right.
Honestly, I mean, Canary Islands, the place to go if you want to live longer, I'm telling you.
But people, you're in the business of selling health insurance to people, and it's compulsory for the vast majority of people, non-lucrative visas, what different visas. Obviously, speak to Anna, you've seen her on the live stream, but the vast majority of people do need private health insurance. And as you say, the private health insurance is very good here, isn't it?
It is. It is. Obviously, the public healthcare system is great for emergencies. I always tell this to people, but when it comes to anything else, seeing a doctor, getting a test done, anything other than a vital emergency, private healthcare is the way to go.
Yeah,
Even Spanish people know that, so that's why there's a huge percentage, especially after the pandemic, a huge percentage of Spanish people actually obtaining their second health insurance, which is a private, because they already have access to the public,
yeah,
just because they need to get things done quicker, and because the service has a better quality. Obviously, people have more incentive to offer you a better service because it's a private sector, not the public. So there is consequence to how well they serve you.
yeah,
Therefore, therefore, it's the way to go. And to be honest, I'm glad that people have to have private because it really does give them the best options when it comes to their health.
yeah. And when you come on, like I say, when you come on a visa, you have to have it.
Yeah.
And for English people, I'm sorry, you have to pay, and it's like, oh. But for Americans, for example, you will save a lot of money by moving to Spain.
I always love to see the faces of my American clients when I tell them the annual prices of when I give them their quotes over a video call, because I always have video calls with them. When I give them their price quote for the year, I always like to see their faces. They're like,
That a month? Is that a month or?
is that exactly? They said, per month? And I said, no. He says, okay, is this only for me? I said, no, it's for the whole family.
Yes,
And it's always a pleasant surprise for them. And then always naturally they tell me a scary story about their healthcare system and
yeah.
how much they have to pay and how the quality isn't that great
Mm.
compared to what they have to pay for
Yeah.
every month for themselves and their family.
Yeah, I think it is. It's like I say, it's a necessary evil when you first come to Spain, and then after a while you can choose and decide what you want to do. But for some people, the private is actually cheaper than paying to join the public. So it's like anything, just do the calculation and see which system you're more comfortable with. For an English person, what amazed me was um, I could just phone a specialist myself.
Yeah.
And like, I need to see someone about what was it, my a foot. Yeah, I need someone about, and they just said, okay, you don't need to go through the GP or anything. And it was really good. And it always takes me longer to give the
Yes.
receptionist my insurance number. I think they just wave me through now than it does actually to wait for the doctor. And for an English person, that's just crazy. It's
Yeah.
just insane. The first time it was really funny. I thought they were sending me to a waiting room. They go down the hall, second left. And I walked through this door and there was a doctor sat in front of me. And I was like, oh,
You didn't expect that. No, that actually, this is a good surprise for people because with at least with Sanitas, I can only speak for Sanitas because I work for Sanitas exclusively. You don't have to go through a GP when you need to see a doctor, so you can go directly to the specialist and get your appointment, get your test done, and it's so fast. So even if you go have a consultation, say today for something that's bothering you with any specialist that you need, you can get your test prescribed in the same day, and then the next day or the day after you get your test done, and only in a matter of a few days you get your test result back. And that's amazing because especially with we're very tech savvy in Sanitas, so the moment that you get your test results back, you can have it on your phone and you can just take a look at it. You don't have to worry about
yeah,
having to actually
I've
physically
seen
go
that.
to the
Yeah.
clinic. So it just gives you quick access to medicine when you need it. Just
Yeah.
everything's really convenient, and that's something you don't get with the public healthcare system.
Yeah, it's crazy because I mean, I just thought being of a certain age now, I've never had a blood test in my life. And last couple of years, I've had a blood test. And I just go and say, I want a blood test. And they go, okay. I want to be tested for everything. And they go, okay. And then I have the test, and about 2 days later, it's on my phone. I mean,
Yes.
luckily, I have a friend who's a doctor, but I could go back and they would look at it for me. But I'd send to a friend and go, yeah, you're fine, or whatever. So it's really, really good. They do look after you. But I think, obviously, there's the Spanish healthcare system is really good, but they're doing themselves some favors, aren't they, with the Spanish diet? We've mentioned this before.
Definitely,
Yeah.
definitely. The Mediterranean diet is the way to go.
Yeah. And
Definitely.
I'm sure it's the red wine, isn't it?
Must be. You would know you're a fan. I drink white wine.
Well, I'm sure that, well, in my research, my extensive research, according to Google,
Yeah,
and looking
go on.
around me, it seems to be that a lot of red wine is actually drunk. But I'm sure that maybe someone will message me in the comments and tell me that white wine isn't so good. But I'm personally drinking red wine, so there's no problem. It's
I
very,
think
very
it's everything.
affordable.
I don't know if I told you about my grandfather. He came from the UK to the Canary Islands to spend what he thought was the last years of his life because he had a stroke and he had to be in a wheelchair because of it. And the doctor told him that he wasn't going to live more than maybe 6, 7 years because his condition was quite serious and he was deteriorating while he was in the UK. And then when he moved to the Canary Islands, he moved at age 60 and he lived up to 82,
Wow. So you got
which is
22
amazing.
years. When he
Which
thought he was in the last bed in the hospital, it was
exactly,
22 years.
exactly. And I always tell this story to my clients because it's a true story, and it's just this. I don't know if it's the Canary Islands specifically or Spain, but it did
Okay.
give him a good quality of life. He wasn't as sick as he probably would have if he stayed where he was,
Hmm.
and also bonus 22 years extra on his
Wow, there you go. Yeah. But
CV.
for example, today I was just in Benalmadena and I was doing some shopping, and you can buy a kilo of practically anything for around about €1. It doesn't matter oranges, potatoes, onions. Um, if you want mangoes, it's a couple of euros. But compare that. I mean, I'm sorry for everybody in America and Canada, but compare that to England. It's just unheard of, isn't it? You can literally
Yeah,
like two heavy bags is about €10. It's
exactly.
incredible.
So you don't have the excuse of saying that eating healthy costs me much because just go
It's
to the grocery store, buy your vegetables, your fruits. It's a lot cheaper than going to McDonald's and
absolutely. I
KFC
mean, McDonald's, Burger King, it's like, what is it now? 10, 12, €13.
per person, exactly.
And and honestly, you go into a fruit and veg shop, as we call them in English, and spend that money, you wouldn't believe what you can get. And there's still like fresh fish shops on every corner, and
Yeah.
it's just like going back in time. You can go and buy like fresh fish. Obviously, in England, there's still butchers in England, isn't there? But everything is healthy. You go to the supermarket, in my personal experience, and you think there's much less processed stuff in the freezer in Spain, I would say. I mean, it's a long time since I've lived in England, but you go in like somewhere like Mercadona or other ones available, and everything is like it's more fresh stuff, isn't it? It's not, you'll get fresh stuff that's frozen as opposed to like 17 ingredients making something in a cardboard box in the
Yeah.
freezer. That even if you want to eat stuff that isn't good for you, you have to struggle a bit in Spain. They're pushing you in the right direction psychologically to eat healthy, I think. There is a lot of
It
fresh
is great. I think that the Mediterranean cuisine in general, the base of its quality is the freshness of their ingredients. I mean, the vegetables, the olive oil.
Yeah, the
Uh,
olive oil, that's in everything, isn't it? Olive
olive oil,
oil.
olive oil, I'm telling you, it's the base of good health.
Yeah, I think that's what they say. It's olive oil is just like
Yeah.
if we had to take one thing apart from the wine in Spain, it's the olive oil, isn't it? The olive oil.
Second best.
You should have that on a health insurance form. Do you consume olive oil every day? If yes, you can have a 5% discount. Because it's like
That's a
medicine,
good
really, isn't
idea.
it? To live on. It's they put it on everything. They're in when they cook potatoes, salads. It's in everything, isn't it?
Yeah, yeah,
And
it's a good thing that it is.
and so much fish. There's just so much fish. Like I said before, fish is everywhere. And they have like like people are the joke in the English is like gazpacho is cold soup. And I always say, look, if you marketed it as a vegetarian smoothie or a
Yeah,
vegan smoothie,
yeah,
you'd sell 100 times more because that's what it is. It's not a cold soup. It's a load of vegetables blended.
exactly. You drink it, you don't sip it, with you don't eat
Yeah,
it with a spoon. I mean, it's a drink.
yeah. And the
So,
And the one without water, the thick one, is salmorejo. There's one
salmorejo,
salmorejo.
salmorejo.
You speak Spanish better than me. Yeah, that's the one without the water. But if they said, look, this is a healthy vegan smoothie, we'd all be having it for starters. But we've heard the rumors. Oh, it's cold soup. I'm not eating that. But it's really good. It's all the fresh vegetables all blended together, and it's really, really nice. It's
Have you tried making it at home?
Yeah, I did, but I did it when I was in the summer when I was living off grid. So I'm miming now, people. I had the pestle and mortar, the
Yeah,
old-fashioned way, because I
yeah.
didn't have a plug-in, what do you call them, blender or whatever.
Yeah,
So
but it's
doing it the
really
old.
good.
But the reason why it was invented is that this is what I've been told is because in the middle of Spain, not on the coast and in the Canary Islands, it can be 45 degrees in the summer, and you just physically couldn't transport that much water to the field with you. So you needed it for like all the electrolytes and salts and stuff, and it helped you hydrate during the day. That was, the reason it was invented, really. The gazpacho. That's why they did it. But it's again, I mean, we can go through everything. It's just a different world here for eating. Yeah. And I've heard American people in particular, when they come here, they've said to me they feel different, like when they start eating the local food.
Good food makes you feel good. I mean, how do you feel after eating two burgers at a
Yeah,
McDonald's, and how do you feel after having a nice dish of grilled fish with vegetables? I mean, how does your body react to
yeah, I
it?
think I think it is. And I've heard people who said I eat more in Spain and I've lost 10 pounds. And I said, well, I'm not a
Exactly.
doctor. I have no idea
This
what.
is the
Maybe you're
quality
just
of the
full.
food. Exactly.
Maybe
It
you
makes
just,
sense. It makes total sense. It doesn't matter how much you eat, but what you eat.
yeah. But I think, what do you think? The psychological thing as well of living in Spain. You've got the sun on your back all day, and it is a different pace of life, isn't it? Compared to like, UK, Montreal.
I wouldn't change Spain for any place in the world. I think it's the best country to live in. I think it's for everyone. I mean, I have two little kids. I'm a mum of two. I think this is the best place for them. It's really safe. I don't feel the healthcare system. I mean, we have both. We have access to both private and public healthcare. Just to have that safety net, because as I said, the public healthcare system is a bit slow. So I always quote my husband on this, that he says that even if we don't use it for a month, the private healthcare is coverage that we have for our family just lets me sleep well at night, because I know that no matter what, my kids will be taken care of.
Yeah.
So that's just one part. So private healthcare here works really well, which is a priority for us because we have kids, we're parents. And then, as I was saying, Spain is for everyone. I mean, older people enjoy it. Most people from the north, I'm not saying only England, but people from, especially here in the Canary Islands, we have lots of people from Norway, from Scandinavia, from Germany, moving, actually retiring from their countries to move to Spain, have a more happy life, more sun on the backs, as you said,
Yeah.
and a better life. And I think it's just young people love to be here. I mean, you have so many digital nomads flocking in
Yeah,
from other
absolutely.
countries to enjoy the way I think the Spanish life, basically, the how easygoing it is, the options that you have. You can go out in the day, you can go out in the night, you can have this amazing food. This everyone's, I think, in my opinion, at least in my experience, people are very friendly here. Even
Mm,
if you're not able to speak Spanish that well, they help you, and they may not be able to speak English, but they're trying to help you. They're trying to get you, meet you halfway. So
yeah.
for me, at least in the beginning, when I didn't know Spanish, that really helped me. So I
Yeah.
think that's just, I think it's a place for everyone. It's a
Yeah,
great
I
country
think
to live
it's
in.
definitely a, a slower paced lifestyle. And for me personally, the one thing I can't get over after 10 years is when you open the door in January to take the dog out and it's dark, you're waiting for the icy blast, and there just isn't one. I mean, don't get me wrong, people. You can go and live in the north of Spain if you like. You can go live up in the Alpujarras like I do, different places. But on the coast, when you open the door in January, it's like, oh, it's like 17 degrees at 10 o'clock at night, in January. That's the weirdest thing. I'll never get my head around that. And it's like another thing is just when you finish work in England at 5 o'clock on a Tuesday in January and it's sleeting and it's black dark and freezing, and it's not here. You can't really put a price on that. And that must affect you physically somehow, mustn't it? It's got to be good for you. We're not
I
doctors.
I live in the Canary Islands, and I'm just telling you right now, outside my office, I have the air conditioning on right now.
The
It's the
the 2nd of December, people. 2nd of
2nd of
December
December. I
2000.
have my air conditioning on to survive because it's quite hot, and there's about 25 degrees outside my window.
Yeah. I mean, when I
So
was in the
I don't
Canary
know what frost is anymore.
I was in the Canary Islands a couple of weeks ago for business, and I managed to get away and see a couple of places. There's a place, and I was just a place halfway up on the east coast on Tenerife, so not a bit more the north than the south. Is Calendera, somewhere like that. And it was 30 degrees, and people were swimming, and this was very, very late November. I thought I'd seen everything, but that was just incredible.
I was on the beach yesterday, and it was a Sunday.
Yeah.
It's 1st of December.
Yeah, I mean, even in Malaga, you've got to be Northern European to be on the beach November, December, January, February. But
What's it like right now?
now well, for me, it's t-shirt weather, 20 something. I'm not, but it's nothing like it was in or is now in the Canary Islands. I mean, the Canary Islands has a nice average temperature, doesn't it?
Yeah, all year round.
Yeah,
Very
all year
stable.
round. And
Nice fresh breeze.
you've got lots of different islands, so you can work out which one's the best for you. Be quite interested going to all the different ones and seeing seeing which island it is. But yeah, that's it really. So I mean, if people want health insurance, speak to Arietti. She's not the group expert for nothing. We do know each other, and she comes on and she tells me about things. So is there anything else you want to say about the whole health insurance thing? I'll put all your
Yeah, sure.
details in.
I just wanted to mention that up until February, just for anyone who's interested, we have end of year campaign right now going on. So we do have some extra features added on to our normal policies that are visa and residency compatible. So you have, for example, you have 50% off at prescription medications at pharmacies, which is great. So
Hey,
every time you go to the pharmacy, buy anything that the doctor prescribed for you, like antibiotics or medicine, you get 50% back reimbursement from Sanitas, which is
wow.
fantastic. It puts money back into your pocket. And then you have tons of digital services. You have physiotherapy at home, digital physiotherapy. We have the dispatch of medication anywhere you are. And I always put myself on this when it comes to this feature because it's so amazing. For example, I'm going to be really quick. So, for example, last summer I used this service because I had it added onto my policy. I was feeling really terrible at a wedding, and it was really annoying me because it was the only weekend we had away from the kids, and I was having such a bad time. My head hurt, was pounding, and my husband said, "Okay, let's just use the features that we have with our private healthcare because we were in the middle of nowhere. We weren't able to get to a doctor." And without missing the wedding. So we just got on the telemed consultation that we have with the specialist because Sanitas is the only one in our competition that does specialists directly 24/7. You
Oh
don't even have
wow.
GPs. So if you need a cardiologist at any moment, you can connect to them. If you
Wow.
need an oncologist, say, you can get connected to them. Anything that you need, any specialist you need, you can connect to them. So we needed a general medicine because it was just my head pounding. And the doctor, it was a lady, she was really nice. She attended us and she said, "Okay, I'm going to prescribe a medication that will help you cure your headache fast." And she prescribed it, and we were able to get the prescription on the app.
Wow.
So, and actually click on dispatch of medication. And I swear to God, 20 minutes later, I had a taxi at the door of the event with
No.
my medication, gave
No
it to
way.
me, left, didn't have to pay anything. Took the medication. Half an hour later, I was back to dancing and enjoying myself. And I'm
Wow.
just so glad I had that
Wow,
option.
so that's Sanitas, everyone, Don't
Yes,
don't even worry. You've got people right there on the video. Wow.
exactly.
Well, that's
So
yeah,
it's
well,
amazing.
that's
It gives you
absolutely
access to medicine when you need it. Speedy access. You can get consultations, digital consultations with specialists. For example, like me, if you need it, if you're anywhere, you don't even have to be at home. If you're anywhere else, you can just request the medication that you need and you can get it. As long as a taxi driver can get to you, you can get it. You can just give it to in your hands. You don't have to pay for it. It's
oh,
included.
wow.
And then you go.
Wow, that's excellent. So you've got
Yeah.
the specialists on your mobile phone when you want them. Obviously, the general doctors included, but if you were having God forbid, a heart attack, you would have been on the phone to the heart specialist as well.
Yeah. Yeah,
Wow.
of course.
But there you go. So if you come into Spain, and you're thinking, oh, I'm not too sure about the healthcare, don't worry. Don't worry. I'd like to say the legal provision is fantastic as well, but just lost listeners. But, the healthcare, don't even worry. You're not going to have a problem. So, Ariette, if you can send me all your details and I'll put them in the links underneath the podcast and the new video channel, if anyone's going to watch us on the video. I should get a Just Lost Listeners sign behind me or
Yeah,
something.
I was going to say something. You need a marketing
Yeah, I
title behind.
don't really know what that is. Probably some Picasso-esque, isn't it?
I was going to say it's probably a rare Picasso that you don't even know
Yeah, I
about.
wish. If I suddenly disappear. Okay, well, thanks for coming on. It's been absolutely brilliant.
Thank you, John. Have a nice evening.
You too.